Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम NCL स्टाफ नर्स एग्जाम 2020 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। What is the normal pulse rate of an infant? A. 72 to 88. B. 88 to 120. C. 120 to 160. D. 160 to 200. Correct answer C. 120 to 160. 29. After some time above patient develop cardiac arrest. What is the best place to check pulse? A. Radial artery. B. Popliteal artery. C. Internal carotid artery. D. Antecuboidal artery. Correct answer C. Internal carotid artery. These. At what rate chest will be compressed and what will be the rate of ventilation in same patient? A. 5:1. B. 15:2. C. 30:1. D. 30:2. Correct answer D. 30:2. 31. A patient of road traffic accident present with BP 76/34 mm of Hg and pulse 133. He is conscious and oriented. Only injury observed was fracture of long bone of right leg with profusely bleeding wound. What immediate action should be taken? A. IV fluid and oxygen. B. IV fluid and prophylactic antibiotic. C. Stop bleeding by using tourniquet in thigh. D. Call surgeon. Correct answer C. Stop bleeding by using tourniquet in thigh. But these. A patient with depressed consciousness has lab report blood sugar 586 mg per deciliter, urine ketone jod. Which if fluid is preferable? A. NS. B. DNS with insulin. C. RL with insulin. D. None of the above. Correct answer A. NS. 33. Malaria is caused by A. Virus. B. Bacteria. C. Protozoa. D. None of the above. Correct answer C. Protozoa. 34. Example of transmission of disease through blood are following except A. HIV. B. Hepatitis B. C. Hepatitis C. D. None of the above. Correct answer C. Hepatitis C. 35. A patient was diagnosed as a case of pulmonary tuberculosis. He was started anti-tuberculous therapy. He complains of red color urine. What to do? A. Send urine for routine examination. B. Urine culture sensitivity. C. Surgical opinion. D. Counseling of patient. Correct answer D. Counseling of patient. 36. A patient of hemorrhagic shock requires blood transfusion. His blood group is B positive. Blood bank informed that following blood group blood is available. Which blood can be used? A positive. B AB negative. C AB positive. D O positive. Correct answer D. O positive. 37. The Heimlich maneuver abdominal thrust is used for a patient who has A bloody nose, B. A blocked airway, C. Fallen out of bed, D. Impaired eyesight. Correct answer B. A blocked airway. 38. 1 teaspoon contains dash milliliter. A. 2 milliliters, B. 5 milliliters, C. 10 milliliters, D. 15 milliliters. Correct answer B. 5 milliliters. 39. For infection prevention, what will you do? A. Clean cloth to patient, B. Change bed sheet daily, C. Hand wash before and after patient care, D. Antibiotic. Correct answer C. Hand wash before and after patient care. 40. What will you do for prevention of pressure sore in unconscious patient? A. Frequent position change, B. Soft bed, C. Hard bed, D. Proper hydration. Correct answer A. Frequent position change. 41. Transmission of hepatitis A virus is by A. Blood product, B. Infected food and water, C. Airborne, D. None of above. Correct answer B. Infected food and water. 42. Transmission of tuberculosis is by A. Blood product, B. Infected food and water, C. Airborne, D. None of above. Correct answer C. Airborne. 43. Transmission of cancer is by A. Blood product, B. Infected food and water, C. Airborne, D. None of above. Correct answer D. None of above. 44. Transmission of typhoid is by A. Blood product, B. Infected food and water, C. Airborne, D. None of above. Correct answer B. Infected food and water. 45. What is the most important step to abort the sickle cell crisis? A. Hourly BP monitoring, B. Oxygen saturation monitoring, C. Hourly offering water to drink, D. Cooling by fan. Correct answer C. Hourly offering water to drink. 46. Patient has not passed urine in last 24 hours. It is termed as A. Anuria, B. Polyuria, C. Oliguria, D. None. Correct answer A. Anuria. 47. There is 10 to 15 pus cells in RA of urine. What it indicates? A. Normal, B. Kidney disease, C. Urinary tract infection, D. None. Correct answer C. Urinary tract infection. 48. A 40 years old lady has increased frequency of urine in night. What does it indicate? A. Patient is diabetic, B. Patient has prostatitis, C. Patient has problem in liver, D. None. Correct answer A. Patient is diabetic. 49. Patient has chronic kidney disease. He has been advised continuous ambulatory peritoneal dialysis, CAPD. Where it should be done? A. Only in well-equipped hospital. B. In any hospital. C. At home. D. All of the above. Correct answer D. All of the above. 50. Patient is on thyroxine. What is the cheap and best way to monitor drug dose? A. T3 level. B. T4 level. C. TSH level. D. None. करेक्ट आंसर डी नन। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।